Yeah, I think there's a big stigma with depression. It's it's a bit shameful, I guess. Like, you're mentally weak.
It's boneheaded to talk about depression as something that makes that person a worse person. They're not worse. I mean, my mother, my uncle, my sister, they're all fine people who can and do contribute to society.
Being in a small town, everyone knows everyone, and everyone knew that my mum had had bad days, I suppose, you could put it that way, and there was a lot of stigma around it because people just aren't aware and don't understand what's going on.
Depression is often misunderstood. Probably the commonest misunderstanding about depression is that it's a failing or a weakness on behalf of the individual, that somehow they're flawed and just can't cope with life, and that it's a commentary on their capacity as a person. And the reality of this is very different, that depression can hit anybody. I've treated some of the most successful people, and you're struck by the fact that even people at the top of society and the top of business and the top of professions can be impacted by depression.
So stigma is something that we really need to wipe out, because having a mental illness is a part of life. It's not a negative thing. So changing the public's view about stigma is really important.
It's kind of like, I went to a friend's house one time and he was watching some Jewish film. I think it was by a famous director or something. And there was like a little girl with this soldier gave this little girl like this badge with a star on it, like a Jewish badge. And they tell you to she had to sew it on and put it on her jacket. The stigma is it's like this invisible badge, and you walk around not worthy of even people looking at you. And if you talk about it, it's kind of like people can see that badge.
People are very aware of the potential impact of their depression on people around them. So the young mother is feeling that she's not a good enough mother. She's not contributing as much as she should to her young child. Or someone in a marriage or a relationship is very aware that they're not able to contribute as much. So at one level they're feeling bad and guilty about it already. I think a second reason is people are very attuned to the stigma and discrimination of depression. While it's much less than it used to be, it's still there. So people don't want to be perceived as what they might see as weak or failing, so they're reluctant to talk about their depression.
When I grew into my teen years, I started to understand what depression was and could actually see it as something, like with my mum, not that she was just sick, that she actually had depression. So at that time there wasn't as much stigma around it, and there was more systems in place, like counsellors at school that I could talk to about the situation. So
It's okay to seek help these days. It's not something you have to hide away. It's not something that makes it impossible for you to get a job or to get married. It's just something that people live with much more sensibly.
I have friends that they do talk to their parents about it who are not Asian, and they're still struggling to understand, but there's a open dialogue, I guess, like there's talking between them. But with the Asian community, like, they just don't want to hear it because we put a lot on face pride and like the family name and like the family line, I guess. And you don't want anything to kind of ruin that.
We know that people are reluctant to see a medical practitioner or another counsellor because of depression, because they're worried about the stigma. And I would not be surprised if people are more reluctant to talk within families because of stigma.
20 years ago, cancer was regarded with a lot of negative feelings. Smoking, for example, is still stigmatised and it's becoming more and more stigmatised. But as far as depression is concerned, I don't think we've gone the way that we've gone with cancer. So changing the public's understanding and knowledge about depression is really going to make a difference to changing their levels of stigma. Unfortunately, it's a slow process.
And until people appreciate and value mental illness as a real part of our society as they do physical illness, then we will always struggle, because there will always be people who feel they can't be themselves, they have to hide their illness, they have to lie about their illness, and they can't function properly because they can't express their illness.